The use of evidence to guide development of clinical decision support systems is important to meeting the Institute of Medicine's initiatives to providing quality health care, and the use of evidence to guide practice is the hallmark of quality health care. Evidence-based practice is a core skill that is necessary to improve nursing care and to enhance patient safety. This chapter provides information on computers, on how data is organized in a computer system, defines evidence-based practice, discusses the evidence-based process, and discusses how to use technology to find and analyze evidence for the appropriateness for the clinical setting. Computers are increasingly more complex and mobile and are becoming increasingly essential to our personal and professional lives. Computers can be used for a single use, connected to a network, can be large or can be small in size. Computer memory is divided into random access, or RAM, and read-only access, or ROM. Data is first uploaded in the RAM and then, when directed by the user, is stored in the ROM on the hard drive, on a USB flash drive, or in a cloud, which is an external location. Software applications are internal programs that include databases, email, presentations, spreadsheets, word processing, creative or communication programs. The ability to effectively use a computer starts with the basic understanding of computer terminology. The American Nurses Association has published 12 approved standardized terminologies that support nurses' work. The International Council of Nurses has developed a framework for nursing practice that incorporates different terminologies to support nurses' work. Using a common nursing language helps documentation and evaluation of nurses' work, improves communication of the work with the healthcare team, and eases data retrieval and analysis of nursing care. The use of standard terminology ensures that communications are understood and interpreted the same way by all the team members. In an effort to help senior citizens who may not be familiar with computers, the National Institute on Aging has developed a glossary of computer terms specifically for the older population. There are three critical components of evidence-based practice: systemic critical evaluation of the current literature, balanced with the nurse's clinical expertise and resources, and considering the patient's values and preferences are all components of deciding to implement evidence into practice. For example, even if the evidence indicates that a particular intervention is effective in improving care, if nurses do not have the expertise or resources to implement the intervention, or if the intervention is contrary to the patient's values and preferences, implementing the practice will not be effective in achieving the expected results. Improved outcomes, efficiency, and cost-effective care delivery are the expected results of all evidence-based practice. Being curious about the effectiveness of nursing interventions is the first step to evidence-based practice. Questioning if the current practice is best and being willing to change and to introduce a new way of practice are essential components of the process. Nurses with a spirit of inquiry understand that evidence-based practice is a way of thinking, not an additional burden to their practice. These nurses will likely become leaders and can influence others to grow their support for evidence-based practice. The process begins with writing the question. PICO is a format and a systematic method that nurses use to formalize their question. It helps nurses focus the literature review and ensures that all components of the question are addressed before starting the literature search. There are internet and textbook resources that can help nurses practice writing the question in PICO format. There are several online sites that provide tutorials on evidence-based practice. Some of these are listed in your textbook. PubMed and Cumulative Index to Nursing and Allied Literature, CINAHL, are two databases that index a comprehensive body of healthcare literature. The best way to search PubMed is through the use of medical subject headings or MESH headings. Your text shows an example of how to search PubMed for a particular topic. Google Scholar is a web-based search engine for scholarly literature. The primary focus is to index all academic papers on the web. One of the most useful features is the Cited By feature that allows the user to view a list of more recent articles that have cited the original paper. It strengthens the Matthew effect, which means that articles with more citations are at the top of the list, while newer articles with fewer citations are on the lower edge of the page and less likely to be read and used. Open access journals are free and available online. The cost of publication in the open access format is on the authors rather than the readers, but the reader must be careful to ensure the quality of the publication. Evidence best practice information can be found in the Cochrane databases, the National Guideline Clearinghouse, the Center for Disease Control, or the CDC, and the Agency for Healthcare Research and Quality. Your text describes these resources. Being able to effectively and efficiently search the literature is an important competency for all nurses. Understanding how to use a Boolean operator, and, or, not, to combine search terms is an important way to limit the search and focus on evidence that is related to the question. There are several electronic databases that have valid and reliable information. Asking the librarian or the nurses with expertise in conducting the literature search can be helpful to the inexperienced nurse. The next slides show examples of how to conduct a Boolean operator search. Here is an example of a Boolean search for articles on the best practices and interventions for fall prevention. You can see that the terms fall prevention, intervention strategies, and best practices are matched with the Boolean terms and, or. In the middle of the screen, you see the search has resulted in, of the next slide, you'll see the search resulted in 6,574 articles. The list can be further limited by inserting the limiters, and here are the limiters: English language, peer-reviewed, and reference dates. Here we have the example I was speaking of: fall prevention and intervention strategies, or best practices. This limits the, you can limit the terms to the results, and you can have a separate PowerPoint that I have listed in the course can show you how to conduct the Boolean search for your assignment. Evidence on the question's topic can be found in the Clinical Practice Guidelines, in a meta-analysis, which is an article that synthesizes the evidence from multiple studies, a randomized control trial, which is a study to where patients are randomized to a group, a single study, a case study, or for some particular conditions, a textbook can be a resource for information. Once the evidence has been analyzed, a plan for introducing the evidence into practice can be formulated. This part of the process begins when identifying a framework for the implementation. The framework can be a nursing theory, a quality improvement process such as Plan, Do, Study, Act, which is also called PDSA, or the use of a change theory. It is important to establish an evaluation strategy as a part of the plan so that the intervention can be evaluated for effectiveness. Strategies to overcome barriers to implementation, including getting others engaged in the process, is key to success. Finally, the plan must address any ethical issues in the protection of health information. The best way to ensure that ethical issues are addressed is to seek the Institutional Review Board's input into the plan. Nursing students have access to the university library resources. Following graduation, nurses who practice in large healthcare systems have similar available resources. Internet resources including PubMed, Google Scholar, open access journals, and government agency clinical practice guidelines are important resources for nurses who work in small organizations that have limited resources and are challenged by the limited resources in their efforts to find evidence to guide their practice change. A clinical decision support system's effectiveness is determined by the interaction of the human and the computer. Despite the best alarm system, if the human ignores the notification, errors can be made. The purpose of the communication mechanism of a clinical decision support system is to collect patient data, apply rules to that data, and to alert the user to cautions that must be addressed to avoid errors. Nurses must be involved in the development of these systems from the beginning to ensure that the system is effective in guiding the user to make appropriate clinical decisions. We will talk more about this later in the semester. In summary, the evidence-based practice process requires a spirit of inquiry, willingness to find and analyze the evidence, and to use that evidence to evaluate clinical practice. During undergraduate education, nursing students are introduced to the process, to research and quality improvement concepts, and have library resources available to help them learn and practice searching the evidence. After graduation, it is important for practicing nurses to continue to engage in a spirit of inquiry and willingness to evaluate practice based upon the evidence. This chapter only touches the basics of evidence-based practice with relation to informatics.